Second motion, Senator Kelly. Minister, you done the other motions?
Yes, yeah.
Okay.
Thank you, Chairman. Minister, you're welcome yet again to this House. Minister, before I came into this House, apart from being a county councillor, I was a community welfare officer for 28 years, dealing with medical card assessments for that length of time. And I always knew and called it that when they decided to centralise the medical cards to Finglas, the PCRS, that I knew that there was going to be problems. I know I can't blame this government for that centralisation process because that was brought in by the previous government. But the problem we have at the moment is that their interpretation of the guidelines for medical cards is different on occasions, and many occasions, than it has been under the old system that was worked locally. One of the problems, for instance, was car loans. Car loans were assessed in medical card guidelines where there was a medical cert provided that there might be a medical hardship. The car loan was allowed. And under the guidelines, it does say, in assessing if a person qualifies under this scheme, the HSE must have regard to the person's overall financial situation and not just their income. There's no reference at all in the guidelines to car loans whether they should be allowed or shouldn't be allowed. But the practice was that they were allowed in medical hardship cases. And I would say, like we also have in the guidelines where house improvement loans are allowed, and that's grand, and I accept that. But you could have a situation where a woman might decide to buy a modern kitchen, to upgrade her kitchen. She may not need it, but it looks nicer, and she goes off and gets a loan for house improvements. That's allowed. But where we're talking about car loans, we're talking about people that need cars to go to work. It's not a luxury to have a car under those circumstances. And many double income families have two cars, and most of the time there's car loans. The other area that the PCRS are interpreting completely different to the way things were done in the past and in compliance with the guidelines is childcare costs. Under the guidelines it says outgoings in respect of childcare costs are allowable provided that the costs are necessarily incurred in taking up or continuing employment, education and training, and in providing family supports. And it also goes on to say to ensure that the costs claimed are reasonable and being incurred and appropriate documentary evidence be provided. That's all. Now, and even on the medical card application form, when it refers to childcare, and this is the new form, it says name and address of creche or childminder. Right? What happened in the past, you could have a neighbour down the road looking after somebody's kids, being paid, and they wrote a letter, the childminder wrote a letter and stated that they were receiving 90 or 100 euros a week for minding the kids, and that was always acceptable. Now the PCRS are only accepting these letters from registered childminders, and there is nothing in the guidelines to say that they have to be registered childminders. Another thing that's happening to a great degree as well, Minister, is that if you have a two-income family and they have two cars to go different directions to work, both of them should be allowed €50 per car for having the car to go to work. In most cases, they're just allowing for one. It has to be brought to their attention. Now, as I said, I'm 28 years dealing with medical cards before I came into this House. And, I'm back doing as much dealing with medical cards in here than I was in the 28 years because of all the problems that I'm encountering. And I just give you one final incident I had recently where a man rang me. Somebody told him he should talk to me maybe about the fact that he was refused a medical card. So I arranged to meet him, and he brought along the income calculation sheet. He never looked at that. He only looked at the first page that said you're not entitled to a medical card, you're over the limit. So I asked him to bring along his P60, and he brought it along, and I looked at it. He was earning 19,500 a year. He was married. The wife was on maternity benefit, had a mortgage, well under the limit for a medical card. Do you know what they told him he was over the limit for a medical card by? 8,450 a week. That's what they told him. So, that's just evidence. Now, they have reversed that naturally enough already. But that's just evidence of all the problems that are still existing out with the PCRS. And I'd like, Minister, if you'd look at those two particular issues, the childcare costs and the car loans, that are necessary and were allowed in the past, and somebody needs to tell them, that, fine, they might want to do business their way, but we're talking about people that had medical cards with these things taken into account, and they go for a review to the PCRS, and they're taking them out. I appreciate your response.
I thank Senator Kelly for raising this issue. Currently, there's over 1.8 million
medical cards issued to individuals in this country. That's the highest number in the history of the state. It also represents an increase of about 500,000 medical cards since the end of 2008. It's expected that the provision of GP services and prescription drugs under the GMS scheme will cost almost $2 billion in 2012. Indeed, I can tell the Senator, although it's not here in my speech, that we've already issued 35,000 more medical cards this year than we had budgeted for. There's 139,000 medical cards extra issued this year. As the Senator is aware, under the provision of the Health Act 1970, medical cards are provided to people who are, in the opinion of the Health Service, unable, without undue hardship, to arrange GP services for themselves and their dependents. Under the legislation, determination of eligibility for a medical card is the responsibility of the HSE. The assessment for a medical card is determined primarily by reference to the means, including the income and reasonable expenditure of the applicant and his or her partner or dependents. The HSE has produced national assessment guidelines to provide a clear framework to assist the making of reasonable, consistent and equitable decisions when assessing an applicant to the GMS scheme. These guidelines are publicly available and can be downloaded from the HSE's medical card website. Under the Health Act, it should be noted there is no automatic entitlement to a medical card for persons on the basis of a specific illness. However, there is a provision for discretion by the HSE to grant a card in cases of undue hardship where the income guidelines are exceeded. The HSE has set up a clinical panel to assist in the processing of applications for discretionary medical cards where there are difficult personal circumstances. The HSE has also a specific system in place in relation to the provision of emergency medical cards for patients who are terminally ill or who are seriously ill and in urgent need of medical care that they cannot afford. These emergency medical cards are issued within 24 hours of receipt of the required patient details and the letter of confirmation of the condition from a doctor or a medical consultant. This system is initiated through the local health office by the office manager. Each year, the HSE processes in excess of 500,000 applications for medical cards and GP visit cards. The HSE centralised the processing of all medical card applications and renewals at the HSE's Primary Care Reimbursement Service with effect from the 1st of July last year. This established a single uniform system of assessment for all applicants to replace different systems previously operated through more than 100 local offices around the country. However, I am aware that there were difficulties with the centralisation project, which gave rise to a large backlog and long delays for both new applicants and medical card renewals this year. However, the HSE took a range of actions which have completely eliminated the backlog of almost 58,000 applications from earlier this year. Excuse me. In fact, the HSE has confirmed that over 95% of complete medical card applications and renewals are now processed within 15 working days. Finally, the HSE has implemented a range of changes to the application procedures which have improved the process for applicants.
Sir. Brief question, Senator.
First of all, Minister, I've no doubt that the person that responded there for you to read out to me probably has 5 years' experience dealing with matters related to health. I have 28. And I take your point that there's 1.8 million people have medical cards now, but that doesn't mean that somebody that is entitled to a medical card shouldn't get a medical card. If they're entitled, they should be entitled to get it. And I wouldn't want it to end up like people applying for carers and invalidity and being refused and being told to appeal it and kicking the can down the road a year or a year and a half, and eventually they'll get what they're entitled to. But you did refer to, in your answer, one thing that you did refer to, there was no mention whatsoever in the answer about car loans or childcare costs that I have brought up. You said clear guidelines. The guidelines, I have them here, and they're as clear as crystal. And the two problems in particular I mentioned, Minister, childcare costs and car loans are referred to in the guidelines and can be allowed, but they are refusing to allow them. They can be allowed. So I'd like, Minister, if maybe you might be able to follow up with them on it and get clarity as to how they're reading the guidelines different to me. I hope never to go back to it.
In fairness to the Senator, I accept that he's got issues here. But there was a lot of latitude shown over the years in relation to car loans, in relation to all of this, when the country was awash with money. We don't have the money now. We have 1.8 million people on the medical card scheme, plus another 120,000 or more on the GP card. We want everyone to have free GP care in this country, and we're moving towards that. But all these allowances that were allowed in the past, there was no absolute consistency across the country in one area's interpretation of this and another area's interpretation of this. So, I mean, I'll certainly revisit it with the Senator, but I have to tell you that as the situation stands, you know, the GMS is a demand-led scheme, and the latitude that was shown in previous years is not open to us anymore because we don't have the money.